order to correctly diagnose a patient, you need to gain info from the patient. First off, you need to gain info on the present illness of the patient. For example, when it started, or any changes in diets or behavior. Family history is also very important. From the family's history, you can learn if there are any genetic diseases that might affect the patient, or if the patient has been in close contact with any sick people. As you may already know, whenever you visit a doctor, they examine you. This examination includes a physical and questions. A doctor is able to gain valuable info about how you are doing, but sometimes that's not enough and the doctor will need to run tests. This is because this will help the doctor see how you are doing on the inside. These tests might include blood tests, x-rays, or other tests. After going through all these steps, a doctor will be able to diagnose you, but it is important to know that not all diagnoses are correct, but most often they are. In this video, we will be going over how to go through these steps using real-life cases. A 2-year-old female who was previously healthy was admitted to the PICU with tachypnea, grunting, and nasal flaring. She is hypoxic even though she received oxygen. The toddler, who has no past medical history, came to the hospital with her mother with 2 days of fever, cough, and difficulty breathing. According to the mother, the patient has had a low-grade fever with a cough for the past 2 weeks. Yesterday, the mother became concerned when her daughter experienced difficulty breathing and a fever of 104 degrees Fahrenheit. Her eating and drinking habits have changed. She has been in close contact with her older brother, who also had these symptoms. Both parents are healthy. The older brother had a cough and fever about a week ago, and the grandparents are alive and well. Paternal grandmother has a history of breast cancer, history of asthma, and allergies is denied. On arrival to the emergency room, the patient has difficulty breathing, which is accompanied by grunting and nasal flaring. She has a high heart rate of 160 beats per minute and a respiratory rate of 56 breaths per minute. On examination, the patient is noted to have diminished breathing sounds over the left lung area. Currently, the patient is placed on 50% oxygen but remains hypoxic. A complete blood count and basic metabolic panel are obtained. A chest x-ray is also done and will be shown after the blood count and the metabolic panel. Pause the video to examine the results if you need more time. There is left pleural effusion with atelectasis of the left lung. Atelectasis is a possibility because of the mediastinum toward the left. This suggests volume loss. There is also a complete obliteration of the lateral hemithorax and of the left lung base. The right lung is shown to be clear. Both viral and bacterial infections can cause common cold symptoms, but it is important to note that they are not the same. Most often, bacterial infections can be a result of a secondary infection. This means that the virus initiated the process, but a bacterial infection followed. The patient's older brother was just sick a while ago with more mild symptoms, most likely from a common cold virus. The patient might have caught the virus from her brother, then also caught a bacteria. Like we already noted, the patient most likely has a bacterial infection. The initial diagnosis is pneumonia. In the chest x-ray, you can see that there is liquid and inflammation in the left lung. Other symptoms of pneumonia include fever, cough, tachycardia, tachypnea, chills, dehydration, and change in appetite. Based on the examination, the patient has most of these symptoms. The patient continues to have oxygen desaturation, even though there is an increase to 70% oxygen. She becomes lethargic with increased work breathing. The toddler is intubated and a chest tube is placed in the left pleural space where about 400 milliliters of frank pus is drained via the chest tube. There are many variables that can affect how a patient with bacterial pneumonia is treated. The variables include the suspected pathogen, age, and the clinical appearance of the patient. For patients who require hospital care, the antibiotic should be, or the total duration of antibiotics should not be less than 10 to 14 days, only if is used, which has a total duration of 5 days. It is important to remember that if the pneumonia is suspected to be viral, then antibiotics should not use because they will not help with the healing of the patient.